Have you been diagnosed as having a candida yeast infection and worried sick because you not sure what it is, or how to treat it now that you have it? You are not on your own, and to put your mind at ease, it is not a vaginal issue you should be deeply concerned about either, as it is not a life-threatening disease. It is an infection that is vastly common. 3 out of 4 women at some time in their life will develop a candida yeast infection. 5% of females have a chronic condition defined as 4 or more occurrences of candida yeast infections annually. We all have a certain amount of candida yeast in our bodies, like it or not. But if it is disturbed, it can unbalance, resulting in mass overgrowth when specific organisms are not at their optimal levels, thus the outcome a candida yeast infection. Although irritating, they do not often lead to critical health concerns. If you at this present minute are experiencing some sort of usualness going on within your body, and are not sure as to whether it is the infection we talk about here, first, I highly recommend you to stop spending so much money on yeast infection treatment products that don't work. Use that money and invest in your knowledge about yeast infection instead. If you don't know where to start, I recommend you to pick up the ebook Yeast Infection No More, written by Linda Allen. I have used her unique 5-step method to help me cure my yeast infection in as little as 12 hours. I put the official website below in the video description. Give it a shot and let me know how it goes. Don't forget to like the video. And don't forget to subscribe. Then you need to know what the symptoms do or look like to help you ascertain the condition. Regular symptoms linked with a vaginal candida yeast infection include itching, burning or pain when peeing and/or during sexual intercourse, genital irritation, clotted-like odorless discharge which is not always present but minimal if it is. What little does show may appear watery or of a thick consistency. When candida masses, if after an upset, then this is when the real problems start. As clearly stated before, candida harmlessly lives in our bodies regardless until it is disturbed. Candida yeast infections are reasoned by candida overgrowth, which can be sparked off by hormonal shifts, including the use of birth control pills, or from a frail immune system brought on by stress, unhealthy diet, or sickness. It can also be provoked by the use of antibiotics, tight clothing around the genitals, right down to the common girly tampon. As with most disorders, they are not always possible to prevent. However, there are definitely things you can introduce into your day that may help shorten the odds of you developing a candida yeast infection. Toss aside nylon underwear and swap for cotton panties. Nylon and lycra material can trap air and create a breeding settlement for yeast. This space needs to be cool and airy. Avoid petroleum-based lubricants for vaginal lubrication and instead, use water-based lubricants for treating vaginal dryness. After using the loo, clean from front to back, always to prevent the yeast which normally resides in the intestinal tract from moving to where it is not wanted. Eating a pot of yogurt daily helps sometimes in holding yeast infections back that often follow antibiotic treatment. Eating yogurt is not a solution for ridding a yeast infection. Avoid fragrance vaginal products. These can cause irritations which can lead to infection. Douching is serious business and not recommended. It can result in washing away the natural protective mucus of the vagina, leaving it more prone to yeast and other vaginal infections. At the first sign of yeast infection, call your GP, or go to your pharmacy and purchase one of the FDA-approved products that are available OTC. If you are embarrassed over the problem, then you could consider treating the infection yourself, but only if under medical supervision. Women are curing their own infections successfully this way. Has your condition been determined by your doctor for an exact diagnosis if you are not sure a subsequent infection is yeast? Other vaginal infections or STDs may have similar symptoms. Yeast infections are normally treated with antifungal vaginal creams that ease the symptoms till finally removing them. You can purchase these antifungal creams, tablets, or suppositories over the chemist counter. Particular conditions BV, trichomoniasis, and yeast infection are difficult to establish on the basis of symptoms solely, so a medical prognosis should be given. You have antihistamines and topical anesthetics also, but these only mask the symptoms and do not treat the underlying cause. The female who suffers chronic or recurring yeast infections may need to use vaginal creams for an extended period of time. Familiar factors linked with increased symptomatic infection include pregnancy, unstable diabetes mellitus, and the use of oral contraceptives or antibiotics. Try smearing apple cider vinegar over the skin where it is more prone to this type of infection, add garlic to stop itchiness, and water to dilute the vinegar concentration, curds or yogurt. Soak a tampon into curds and insert for at least 60 minutes. Basically, the healthy vital bacteria from the curds will replace bad yeast bacteria. Add buttermilk to your daily diet. Drink at least 2 glasses a day. Curds will help decrease the probability of yeast infection, and is this not what we girls are looking to do? The tips I gave you here helped me on curing yeast infections, and I'm sure that they'll also be helpful to you too, but there's actually one more tip I'd like to share with you that permanently and naturally cured my yeast infection. Click the link below to know more about my secret.